I now call on Decent Work and Health Network. Good afternoon. If you could please identify yourself for the Hansard and then begin your 5-minute presentation.
Thank you. My name is Andrew Pinto. I'm a family physician, a public health specialist, and a scientist. My research is focused on the social conditions that impact our health, or what we call the social determinants of health. I'm also a member of the Decent Work and Health Network. We're a diverse group of Ontario's health workers. We understand that employment status and working conditions are key determinants of health. I see this embodied literally in the patients that I serve in my inner-city Toronto practice. Many are dealing with the closely related issues of poverty and precarious work. For example, I think of a patient of mine who I'll call Aisha. She's in her 40s. She's a single mom. She works as a personal support worker with very irregular hours. She's not unionized and she has low wages. She's constantly on call for work, and she's unable to plan ahead for herself or for her child. She struggles to make rent and put food on the table, and recently she developed diabetes. The chronic stress of her work situation, fear of losing her job, and low income manifest as insomnia, anxiety, and difficulty controlling her blood sugar. Now, there's not much that I can prescribe to her that's going to assist her, but today this committee and your work as our members of government can do something for her through Bill 148. This is why the Decent Work and Health Network sees this legislation not only as employment policy, but as health policy. Now, this single case that I've outlined is replicated hundreds of thousands of times in Ontario. Many studies at the population level confirm the link between precarious employment and poor health. I'm going to focus now on 3 areas: the increase to the minimum wage, paid personal emergency leave, and scheduling. So in terms of the minimum wage, I think that this will promote health in the province. A $15 an hour minimum wage will help people make basic needs that are important for your health. As you know, the current minimum wage keeps people in poverty. There are many benefits to a higher minimum wage. Just to illustrate one, last week the Institute for Health Policy Management and Evaluation at U of T hosted a researcher from the National Bureau of Economic Research in the U.S. who described that research, from his research, raising the minimum wage across multiple states in the U.S. was associated with improvements in children's health. So in terms of reducing the risk of low birth weight and premature birth. So I believe that this increase in the minimum wage cannot happen soon enough. In terms of personal emergency leave, I'm also happy to see the province is introducing this. So for the first time, Ontarians can actually follow what their doctor says to stay home if they're unwell. And we know that without paid sick days, workers will go to work while they're ill because they can't afford to lose income, and they could even be fired. This poses a risk to their health and also the health of others in the workplace. However, the current 2 paid days are not enough. Even the most common illness, for example, flu, and we're just entering the flu season now, usually takes 48 to 72 hours to recover from. And if a patient has to do tests or see a specialist, this quickly exceeds those 2 paid days. So we're encouraging the government to increase the number of days to 7. This allows patients enough time to address their health needs and other emergencies that arise. Finally, I want to talk about scheduling and how unpredictable scheduling has an impact on people's health. A growing number of studies has shown that jobs with unpredictable and unstable work schedules are strongly associated with a higher incidence of work-related injuries, chronic stress, fatigue, and conflicts in people's lives. Even more serious conditions can result, such as heart disease. And we end up paying for these negative impacts through healthcare costs and other social costs. So I was concerned that during the amendments, the language of the scheduling rules was weakened, and now there are several exemptions. Without strict language, employers will interpret this to their advantage. So it's important that no loophole is left open, and importantly that workers receive their schedules at least 2 weeks in advance. Just to summarize, the government has a responsibility to protect workers, and a fair minimum wage, protection if you do fall ill, and having your schedule at an appropriate interval will help protect the health of Ontarians. Thank you very much for your time.